So just published yesterday, October 21st, 2024, from the American Heart Association and American Stroke Association is a new clinical practice guideline on the primary prevention of stroke. So this is actually a 2024 update to the 2014 guideline and is intended to provide primary prevention strategies for individuals with no history of stroke in the past and who have or are at risk for developing cerebrovascular disease. So with that, some of the new recommendations include things like screening patients for risk factors and potential barriers for care that could confound their outcomes. So things like social determinants of health, sedentary behaviors, as well as transgender health considerations. There's also recommendations for lifestyle changes, things like a Mediterranean diet, increased physical activity, tobacco cessation, sleep hygiene, and weight management. There's also recommendations for managing comorbidities so that we can have primary prevention of stroke through that modality. And that includes guidance and some recommendations for things like diabetes, hypertension, antiphospholipid syndrome, SLE, and endometriosis. And then kind of piggybacking off our comorbidities, there are some new recommendations supporting the use of GLP-1 agonists for patients with diabetes who are at high risk for or have established cardiovascular disease. And then for our blood pressure management, there's also some new recommendations there, including one for the use of 2 or more antihypertensives for most patients needing pharmacological treatment, as well as some hypertensive management recommendations for the peripartum and postpartum period to help reduce the risk of fatal maternal intracerebral hemorrhage.